Welcome to Health Pulse episode. This is Dhrupal Patel, your host, and I'm thrilled to announce our guest today, Nick. He's the CEO for Compliagent. Nick, great to see you again, and thank you so much for time to join us today. How's your day going on?
Everything's good. Great to see you, and thank you for having me.
Great to hear that. And we will keep that energy on. And I think we had a chat earlier. You used to live in DC and now you are joining from LA, right?
Yeah.
You actually lived in DC, LA, which is two very different worlds. What are the one thing you miss from East Coast and what's something you absolutely love about West Coast lifestyle?
I'll tell you, the East Coast and the West Coast do have a lot of differences. I think you're right. I grew up my whole life really on the East Coast, and I married a girl from Los Angeles. So we actually met as undergrads. And we eventually got married and moved out to the West Coast where she was from in Los Angeles. Some of the things I miss is really kind of like the densities of the cities. I loved, we lived not only in DC, but we also lived in Manhattan when I was in law school for 3 years. And I loved being
Right.
able to just pop outside my door and, walk to the supermarket, walk to the movies, walk to a cafe, walk to a restaurant, walk to school and work. When I was living in DC, I actually started as a lawyer in DC. I used to walk to work every morning. It took me about 25 minutes, and that sure beats LA traffic. But LA is great. I mean, the weather is amazing. It's nice to be able to pretty much be outdoors, almost every day of the year, and that's nice. And we've made a lot of good friends out here, and I think there's a lot of fun to be had in LA and a lot of interesting stuff going on as well.
Awesome. I'm glad that you settle and you like West Coast. Eventually, I don't know, I might be there as well. So just finger crossed. Okay. How about the teaching side of your life these days? I know you've been preparing for your visiting professor role in India.
Yeah.
Must be exciting.
Yeah, so I've been teaching at USC Law School, and before that, they have a healthcare management program through their School of Public Policy for about 10, maybe even a little more years. And I started off just by giving a guest lecture for one of the professors there who I had met at a healthcare conference. And he said, "Oh, what you do is interesting. I'd love to have you talk about it to my class." And I did that. And it was a little bit of a setup because afterwards he said, "I would love for you to teach this class next year." And I said, "Well, I haven't done this before, but I did, and it was good." And eventually I moved over to the law school, which is a little
Great.
bit more of a natural home to me. And I taught courses in healthcare law, healthcare compliance, and also more general courses in regulatory compliance. And I got an opportunity through someone I met that had been teaching at the National Law School of India in Bangalore for a few years,
Wow.
and he wasn't going to be going this year. And he said, "I could put you in touch with the dean. That sounds interesting what you teach." And I was able to work it out. I applied, I went through the whole process, and I kind of adapted my course that I usually give at USC for a more international perspective that I hope it'll work. So I'm going in kind of April and May next year. And yeah, it's a little scary and kind of exciting.
No, you should be fine. I think I wish you all best of luck for you and your
Thank you.
travel and your journey in professional side. So today's will be very relaxed, more thoughtful conversation than like usual or formal interview. We will explore your personal background, your journey with compliance through law and healthcare compliance. So the work you are doing at Compliagent and some of the exciting shift you are seeing as AI enters the healthcare. With that said, let me start with this. And before, I go to the professional journey, I also remember that you would enjoy your learning to surf and enjoy basketball. So, what does those activities bring into your life that your professional world does not? It is like your passion or something that keeps you grounded. Like I know you wore a lot of hats, and I can think of those journeys as well. So,
Yeah, definitely true. I mean, one of the hard parts in modern society and working in the world we do is we spend a lot of time indoors, a lot of time looking at screens like we are now, unfortunately. Any opportunity I get to, meet people face to face, interact and do things with people outside, especially under the sun and, blue skies, I take it as much as I can.
and you much need it because you need some off time, to, balance a life. So, and you also have a family with three sons.
Yep.
So what's typical weekend like you for you when you are not juggling with compliance, teaching, or client commitments?
We like to do things together as a family when we can. It's hard when my kids are all teenagers or even a little bit older. So, and two of
Right.
them are actually married already. So it's hard to coordinate seeing everyone and all of that. So we use a lot of the weekend time to catch up with them. And we can't, we don't get to see them as much during the week. And we try to do a lot of things together as a family, get outside and enjoy the outdoors and see friends and just kind of relax a little bit.
Great, great to hear that. So let's start with your story because it's a fascinating one. For people who may not know you yet, who is Nick outside of titles, how do you usually introduce yourself?
Yeah, it's a good question, right? Healthcare compliance isn't a great conversation starter at a cocktail party usually. Well, I'll tell you a little bit, in a lot of ways, I started off professionally as an attorney and kind of fell into doing healthcare law and did that really for the first part of my career. And in many ways, I still see myself as an attorney, although the function of care compliance and being a compliance officer is a little bit different than being an attorney. So, what I try to describe to people is that when I was an attorney, my job was to defend the organization or advocate on behalf of the organization. As a lot of what I do now is really serving as a outsourced or interim compliance officer for kind of expanding healthcare organizations or helping organizations that have acquired maybe a smaller practice or a smaller provider group and integrating them into a larger corporation. And it's really more of a management function. It's really very
Mhm.
collaborative with the staff and the executives of the organization and really trying to help them meet their business goals, their operational goals, their compliance and legal goals, mitigating their risk and things like that, helping them meet their marketing goals or their clinical goals, even in healthcare, but doing it in a compliant way and really sitting down and taking a deep dive into their market strategy, their business strategy, and even their clinical strategy, and trying to
Mhm.
figure out the best way to do things in
Mhm.
an industry like healthcare, which is really highly regulated. It's
Right.
very different than, running a shoe store or running a lemonade stand. There's this overlay of state laws, federal laws, even county and city laws at times that govern how healthcare organizations get paid, get reimbursed, how they have to staff, who they can hire, what they have to do with healthcare information from a security perspective, from a privacy perspective. And it's rewarding, but it's very complicated. And so sometimes for an organization to get to their true goal, which is really serving their patients or, serving their clients or their residents, depending on what kind of healthcare provider they are, there's a
Right.
lot of hoops they have to jump through from a regulatory perspective. So the way I see it is my job is to make that happen for them and put the infrastructure in place for them that makes them able to operate in the way that they want and do the job they need to do for the population they're really serving.
Thank you so much for that insight. Actually, about to ask that question along those lines, like when you look back on that decision, leaving the conventional legal path to build something new, what's motivated you? What convinced you that the risk was worth taking in healthcare?
Yeah. Well, I always had a very entrepreneurial side to me. Even from since I was a teenager, I was very into, having my own business. Some friends and I, started various businesses even when we were in high school.
Mhm.
So I think that we kind of identified, my partners and I really kind of identified a gap in the market that really wasn't being served. Law firms and lawyers, and I come from that background, do a lot of really important work. The type of management that I'm talking about, and a lot of it is really driven by the Affordable Care Act and sort of a proactive need for compliance plans, was very hard to get done under a law firm umbrella. And I was in a law firm at the
Right.
time that, we decided to embark on this. And,
Mhm.
I saw a lot of clients come to us and say, can you help us with this? But really, it didn't work under the fee structure of the law firm. It didn't work well even under the professionals that a law firm has because a law firm can only have lawyers, really.
Right.
And, we needed other types of professionals like clinicians, which we have in Compliagent. We also have, people from in healthcare executive background who have run healthcare organizations before. And to really do the work that we now do with expertise, you need to bring all that knowledge and all that expertise to bear. And I think that's unique about what we do at Compliagent and what makes us an industry leader in what we do.
Awesome. And your personal journey is genuinely fascinating, truly. And I feel like it's connects so well to your professional path. So let's shift a bit from a personal journey into the world that you have built professionally, because it's such a unique niche. Compliance plus healthcare, it's a very unique niche. What led you to create Compliant? When you look back 14, 15 years ago, what problem did you see in the healthcare organization that made you think that I shouldn't go for ordinary law or compliance, better to focus on the healthcare compliance.
I think that, a lot of the ways that lawyers operate is very reactive, right? Generally, a
Right.
lawyer gets involved when, there's a problem already, right? You
Correct.
get a lawsuit, you're under investigation. It could also be for positive reasons. You want to make an acquisition or there's a merger going on or something like that.
Mhm.
But they're very episodic. And, what I mean by that is there's very narrow tasks that the lawyer needs to do for the organization. And those are, important tasks and require
Mhm.
knowledge and sophistication. Don't get me wrong. But what I was really interested in, and I think what inspired me, was the proactive nature of that.
Right.
To do something a little less adversarial and to build something and, to help other entrepreneurs, to help people who, have dreams of a successful healthcare organization and, have real client treatment goals and real goals of improving society and even profit goals to
Mhm.
build their organizations in a compliant and efficient way. And, I think that was really kind of interesting and fun to me. I was a litigator really by background. I did a lot of my initial work, even in healthcare, either in the courts or in administrative hearings or, against government investigations and things like that. And that was always
Mhm.
very adversarial. And it felt really good when somebody comes to me and says, hey, I've got an organization and we're growing fast. We have this great idea to improve, you know, addiction treatment and do something unique. And now we're growing really fast and we have all these questions. And, we've talked to some investors, but what they want to see is a little more sophisticated infrastructure from the legal and compliance
Right.
standpoint. Can you help us? And, to me, what I love about that is the creativity involved and I'm an entrepreneur along with them because I'm helping them build their organization, but
Right.
also when I was a lawyer, I was always a cost, right? Even when you're doing
Right.
something positive and, maybe selling your organization, there's always a line item for how I was going to get paid. And that came out of somebody's pocket. Now, we
Exactly.
charge for what
Yeah.
we do for sure, but I think there's a lot of return on the investment in what we do because what I really want to tell people is we're going to make your organization more valuable by the work that we do. And when that day comes when you get acquired or you're looking for another financing round or you're growing, that's, the work that we do, being able to answer questions in due diligence, for example, that are going to
Mhm.
ask, what's your training program like for healthcare privacy? What's your
Right.
infrastructure like to ensure that the reimbursements and the cash flow that we're reading about on the financial situations and the financial statements are real cash flow that's coming from legitimate healthcare activities and not something else. That's going to take your organization from, a 5x multiple to a 10x. And that may be
Right.
worth millions to you. And, there's no better engagement for me in the work that I do and the work that we do in Compliagent is when, I've known a client when they were only one office or, two clinics or something like that. And
Okay.
5 years down the line, I'm still working with them and they're in 10 states. In 8 years, they're in 25 states. And then all of a sudden they come to me and they say, good news and bad news. The good news is we're being acquired. The bad news is,
Mm.
we're all going to be gone. And, sometimes
Right.
that's a little bit painful because I've worked with an organization for years and they're just going to get swallowed up into, some multi-million dollar national organization, that really has their own compliance infrastructure already and doesn't need me as much. But I consider that, very fulfilling when that happens. And, sometimes I stay on. You'd be surprised. continue to help the organization, after the acquisition or financing or whatever it is.
And you literally see when you're helping your clients with compliance, is it really create the real ROI or increase the valuation for them?
Sure. I've seen it happen, and I can, the easy way to me to prove it to anybody is to show them, obviously without the names, but show them copies of due diligence questionnaires that
Right.
organizations that I've worked with had to respond to when they were getting a financing round or being acquired, and show them this is what you're going to be asked, whatever your time horizon is, 1 year, 2 year, 5 years. These are the types of questions you're going to be asked, and I want to be able to answer them easily and in a way that's going to impress the acquirer, and in a way that is going to satisfy their counsel, and in a way that's going to make their bankers confident in whatever financial component there is. And I can show you, if we put this in place, you're going to be a great target for that, and it's going to make the process of due diligence easy, and there aren't going to be surprises, and there shouldn't be any reason why this shouldn't go through, because the biggest reason that deals like that fall apart are legal and
Mhm.
compliance. Somebody sees something and
Right.
says, I don't trust these numbers. I don't know, I don't trust your reimbursement model. This doesn't make sense to me. This is too risky. And it's a shame, because if it's something that a year, 2 years before we had been involved with and we could have advised them, we could have structured things in such a way that could have, lowered their risk threshold and
Mhm.
made it, more attractive to the bank or to the, private equity fund or whoever it is, at the time of acquisition.
That's awesome. And that's why I think currently the Compliagent, it's really well suited, and helping other agencies, other customers. So, and you are doing really interesting work in AI governance. I think last time we talked about AI governance, which is becoming a massive topic in healthcare nowadays.
Yeah.
Like if you could explain like how AI governance, to the organization, and it's really, you know, kind of, is it like a more of the risk or it's kind of a responsibility to adopt? I mean, can you give us a little bit insight on that?
Well, so the way I would talk about it is as follows. Healthcare as an industry is one of the quickest adopters of AI
Hmm.
platforms and AI technologies. I mean, it's
Right.
true in, many areas of the economy, but in particular in healthcare, I think AI, has clinical applications, it has operational and financial applications, it has legal and compliance applications, marketing, all sorts of things. And the pace at which healthcare organizations, like, everything from hospitals to digital startups, are adopting AI is,
Right.
it seemed to us a lot faster than the compliance infrastructure around AI. So there's, what we try to do for people is implement an AI governance program. And really what that means is we want to make sure that if you're adopting, first of all, we want to, help you evaluate the AI technologies that you're
Mhm.
bringing into the organization. There might be questions of bias, which has become a
Right.
big issue in AI, especially in healthcare. There
Right.
may be questions of data privacy and security. There are a lot of issues related to that. There's, sort of reliability. If you're using a technology that's going to indicate to you whether or not a certain, clinical procedure is warranted, is
Mhm.
that causing overutilization? Is that causing underutilization? To whom? Is it treating African Americans differently than it might some other group? Something along those lines. So when you adopt those technologies, you really have to look at them and, figure out, are they right for you and what the risk is. And, once you're doing that, you really need to have policies and procedures in place that govern your adoption and use of AI. You need to have the proper training for your staff on how to use
Right.
AI properly, how to do it well, how to protect information, how to,
Mhm.
make sure that you're free from bias and things like that. And that's a lot of
Right.
training. And then you have to do a lot of internal auditing and monitoring. And you have to document all that, because, there's a lot of risk that an organization takes when it uses AI technologies, because it's so new and because it's just so all encompassing. And being able, not only doing that, but being able to lay that paper trail of infrastructure that you've built is going to be really, really important, because the time is going to come, if you're an organization of any size, where you're going to get a lawsuit that has something to do with AI. You're going to have a bad outcome for a patient, and AI is going to
Right.
be involved in that process, and you're going to have to defend it. There's going to be a government investigation on, an allegation against you, for bias again, like I've been using, and you're going to have to be able to defend that. A data breach is going to happen, and it's going to be, there's going to be allegations that AI was the cause. You want to be able to show the good faith attempts that you put into place to manage that and to avoid those kind of things. And that's going to go a long way in terms of mitigation of risk. So, what I tell people is don't spend millions on the technology without, making sure you're laying that foundation within your organization of how to use that technology. What I tell people, it's like buying a
I agree.
$100,000 car, but forgetting to lock it, right? Like, there's no point in spending $100,000 for a car if you're going to leave the keys in the ignition and the door open. Make sure you took the keys and you close the door. And, let's start with that to use an analogy.
I agree. And I think that is the best example I think you gave. And usually, means in the last conversation, you mentioned like wanting Compliagent to involve in more digital, scalable direction, especially to serve a smaller healthcare organization more efficiently. Where do you imagine Compliagent being 2 to 3 years from now as the
Well,
landscape continue to shift towards automation, digital workflow, AI assistance, AI governance?
one of the tough things for in healthcare is there's a lot of great organizations that are small. Unlike
Hmm.
some industries, like let's say maybe defense or oil and gas or something like that, in those
Right,
industries, the players tend to be very, very big. What many
right,
people don't realize, especially in the United States, is healthcare. There are certainly some very big players out there, but there are hundreds and hundreds and thousands of mom and pop organizations and smaller organizations that are the backbone of US healthcare. Without those organizations, we couldn't operate and provide the best healthcare in the world like you can get in the
right.
United States. And, unfortunately, because of all the regulation and because of, a lot of that we've been talking about the last 10 or 20 minutes, it can be
Mhm.
really expensive to be a small organization and, you know, meet those compliance goals and build that compliance infrastructure. So, what I'd like to do and what I see Compliagent doing is coming up with with effective and lower cost ways for those organizations to meet those obligations. And the way I see doing that is digitally with the use of AI. And, we're working on things like that right now in
Right.
the compliance management space, in the AI governance space, in areas like that. And, that's where I'd like to see us in 2 or 3 years, really being able to offer that to organizations that until now had been cost prohibitive to really get the help you need to make your compliance infrastructure commensurate with
Mhm.
what it needs to be.
And wish you all the best for that journey, that goal. The healthcare has changed a lot dramatically in terms of compliance, risk, AI adoption, data security, especially in healthcare. So, from your perspective, what's changed the most in the last 5 years for the organization you serve?
Oh, that's a great question. I think the move within healthcare to more digitization. Until 5 years ago, maybe 10 years ago, arguably, healthcare was a very much pen and paper. Things were sent by fax. I know fax sounds like an advanced technology, but today it's not,
Hmm.
right? I'm talking about faxes that printed out documents. Documents were put in paper files, and to give you an example, a lot of the HIPAA privacy and security regime that we have in place is really built around and was written at a time when we were talking about reams of paper files.
Right.
That hasn't kept up, in
Hmm.
my opinion, and I think in the opinion of a lot in the healthcare industry, with the need to protect things digitally and the threat that first of all, it's necessary. You need to digitize today to remain competitive. You have to have quick access to that information. You have to be able to, in order to practice medicine in a sophisticated way. But
Right.
there's risks involved in that. Now, in servers and hard drives and on clouds, there's reams and reams of data that used to be in a
Right.
locked file cabinet that in some ways was a lot easier to protect. Or if it wasn't,
Right.
what was the maximum that was going to happen? Someone was going to walk in the room, grab what they put into their hands and run off with it. That was a very
Right.
small type of breach. Now you're talking about with a few wrong key clicks, you could expose 50,000, patients. So I think the
Right.
danger of that, and, unfortunately, the people, the bad guys, so to speak, are aware of it. So I think, like a lot of industries, healthcare is really working hard to stay ahead of that. So I think that's one of the really big challenges, and it's something we work on a lot day to day within the healthcare industry.
Awesome. I know you are working with the healthcare providers, agencies, small business groups in healthcare. When do you see when you try to explain them, or I also like where do they struggle most? Like, is it they don't have much clarity on guidance? If they are not easy, I mean, it's a resistance to adopt the compliance, or maybe some
I,
operational bottlenecks or something else?
Yeah, I think most organizations have the best intentions. There's very few
Hmm.
organizations that I've ever worked with that, said, okay, we're going to try to commit fraud, waste, and abuse or something like that. I think a lot of what you see is there's a temptation to, download policies off the internet. Because if I Google hospital policies, I can find 1,000 examples of, different things.
Right.
If I Google, healthcare training, I can find a lot out there that's low cost or free or whatever. And I think what a lot of organizations, especially ones with financial constraints, do is just download stuff off the web, go through the motions of having policies that really don't address the day-to-day operational and clinical work that their staff does. So those policies don't really provide any guidance or answers. They're doing
Right.
trainings that are completely disconnected from those policies anywhere. I call it checking the box, right? They're just doing it to check
Right.
a box. And then, I can tell you what that looks like on cross-examination, right? Someone will, your opposing counsel is going to come up with a policy and say, well, it says on page 3 over here, can you read this for us?
Right.
And you read something, and then they're going to say, well, do you do this? No. Did you ever train your staff to do this? No. Did you ever audit this or monitor that this was going on? No. So you kind of dig a hole that's even worse for yourself in some ways, as if you didn't have policies or trainings to begin with. Because not only don't you have the right ones, you have ones that are totally wrong. And it's obvious to everyone that these were check the box. And, they're not helping you, they're hurting you. So I think that's a challenge that a lot of, especially smaller organizations with resource constraints have. But
Hmm.
they should know, there are ways to address that.
And I agree on that. And this is my best question. I think, if you had a magic wand and you can instantly solve one challenge, in Compliagent for the clients you work with, what would you fix first?
I think that usually the first thing I look to is getting a good set of policies in place. On the compliance side, on the clinical side, on the operational side, your staff needs that direction of where to look at. And
Hmm.
only once you have that can you take the next step and train on those policies and monitor and audit whether, compliance with those policies, and only after that are you really able to, really effectively address the regulatory requirements that are kind of inherent within healthcare on your organization.
Awesome. And for the leaders in healthcare or compliance space and listening to this podcast or episode, if you could offer one piece of advice to them, what would it be?
I would say that take your compliance obligations seriously, not only because they're a requirement and because there's, legal implications to addressing them, but also because
Hmm.
it's going to make your organization stronger. It's going to strengthen your staff. It is going to make your organization more valuable, like we talked about before. It's going
Right.
to enable you to deliver better care to the patients and to the residents and to the clients that, is really your life's work.
Right.
And, if you don't look at compliance just as a cost, don't look at compliance just as policing. Look at it something that's a management function in the same way, in a crucial function, in the same way the
Hmm.
financial function is, the marketing function is, the sales function is, the clinical
Right.
function is. And if you do that, I think the rewards are great. Not only will you have ROI in terms of risk mitigation, but you'll have it in other areas of your company. It's really the backbone of your organization.
Great. Thank you so much for sharing that. And if someone wants to learn more about your work, about your journey or AI governance, where is the best place for them to reach out to you?
The easiest just to go on our website,
Hmm.
www.compliagent.com. That's Compliagent. Our phone numbers are on there. Our email addresses are on there. Great ways to contact us. We also have a pretty good social media presence. If you're on X, if you're on LinkedIn, if you're on Facebook, join us. We, on a daily basis, have tips and link to articles and things that are important in the healthcare compliance field. It's great to be connected in that way as well.
Awesome. Awesome. So, Nick, this has been a fantastic, truly, your insight and few things you mentioned, especially around digital scalability and the future direction of AI governance, really caught my attention. And I hope that, our audience, that's exactly the perspective they are love to hear. So again, thank you so much for your time and
Thank you.
your insight on AI governance. I really appreciate it.
All right. Thank you, Dhrupal. It's great to be here and nice meeting you.
Awesome. Thank you so much. And signing
Have a
off
good
now.
day. Bye bye.